Hi, this is Dr. Jamie Smith, and I'm doing a presentation on advocating for policy change, expanding insurance coverage for integrative medicine. We're going to be talking about enhancing patient outcomes and business sustainability. Now, my policy change proposal is about expanding insurance coverage in Michigan to include integrative medicine services such as acupuncture, chiropractic care, massage therapy, and holistic health coaching. It's important to address gaps in coverage in holistic care. Current policy limits insurance coverage for integrative and holistic medicine. Um, Medicare provides limited coverage for acupuncture, specifically for chronic low back pain, allowing up to 12 sessions within 90 days, with the possibility of 8 additional sessions if improvement is demonstrated. However, Medicare does not recognize licensed acupuncturists as independent practitioners. Instead, acupuncture must be administered or billed by other healthcare providers such as physicians or nurse practitioners within their scope of practice. Many state Medicaid programs model their coverage policies after Medicare guidelines. Consequently, Medicaid recipients often face similar restrictions with limited to no coverage of acupuncture services provided directly by licensed acupuncturists. For instance, the Minnesota Healthcare Programs, or MHCP, cover acupuncture only when performed by licensed acupuncturists or other Minnesota licensed provider for whom acupuncture is within their scope of practice and who has specific acupuncture training or credentialing. These coverage limitations create barriers for Medicaid recipients seeking acupuncture, particularly from licensed acupuncturists, thereby restricting access to integrative health services. There is a demand for increasing non-pharmaceutical patient-centered approaches. Now, many low-income and marginalized communities lack access to integrative health services due to insurance limitations. For instance, there are preventive care benefits, holistic care approaches like acupuncture, nutrition, counseling, and mind-body practices reduce chronic disease burdens and hospital admissions. There is cost savings for healthcare systems. Studies indicate that integrative therapies can lower costs associated with long-term pharmaceutical use in emergency care. And there is a growing public demand. Surveys show that an increasing number of patients seeking alternative and complementary therapies highlight a misalignment between consumer needs and insurance policies. Minnesota has made strides in integrating acupuncture into its Medicaid system, known as Minnesota Healthcare Programs. Currently, MHCP covers acupuncture services when provided by a licensed acupuncturist or other Minnesota licensed provider authorized to perform such services. Beneficiaries are allowed up to 20 units of acupuncture per calendar year without prior authorization, and additional sessions require authorization and must demonstrate favorable patient response and expected further improvement. In 2018, the Minnesota Department of Human Services conducted an analysis to assess whether acupuncture usage amongst Medicaid enrollees was associated with reduced opioid consumption. The study concluded that there were no significant differences in opioid use between those who received acupuncture and those who did not. While Minnesota has established coverage policies for acupuncture under Medicaid, specific case studies detailing the successful implementation and outcomes of expanded acupuncture coverage within the state's Medicaid programs are not readily available in the provided sources. Further research, including direct inquiries with Minnesota's Department of Human Services or academic institutions, may yield more detailed studies on this topic. Now, I'm hoping to use what Minnesota did to expand coverage in Michigan. Currently in Michigan, there is no acupuncture coverage for Medicaid recipients because they simply follow Medicare guidelines. And Medicare does not currently credential acupuncturists. It would take a bill of Congress to be passed in order to do that. Now, with expanded coverage to include evidence-based integrative medicine practices, you want to establish standardized reimbursement guidelines for holistic healthcare providers, and you want to implement pilot programs in state Medicaid and private insurances for cost effectiveness. Now, a systematic review found that nearly 30% of integrative medicine interventions were cost savings compared to 9% in conventional medicine, indicating significant potential for healthcare savings. Implementing integrative approaches such as yoga therapy and holistic nursing in inpatient oncology settings led to substantial reductions in medication use and associated costs. The American Board of Integrative Medicine offers board certification for integrative medicine practitioners, requiring completion of a approved fellowship or graduation from an accredited programs in naturopathy, acupuncture, or chiropractic care. Now, if we can adopt national standards for licensing integrative medicine practitioners, we can ensure consistent qualifications and competencies. For that, we want to also develop clear billing codes and reimbursement policies for integrative services, facilitating seamless integration into existing insurance systems. And we want to encourage partnerships between integrative practitioners and conventional healthcare providers to promote coordinated patient-centered care. We would also have to have patient outreach for awareness of covered services, and we would need to work with industry experts to create evidence-based policies. There are several benefits to change. Patients can have increased access to integrative care solutions, improved health outcomes, and reduced reliance on pharmaceuticals such as opioids. For businesses, they can expand markets for holistic care providers, providing economic growth in the wellness industry. And for insurers, potential cost savings from preventative and holistic approaches can reduce the chronic disease burden, which is an epidemic in this country. There are three phases that I would propose for this. Within the first 6 months, I can imagine conducting stakeholder meetings and gathering additional data to look at the feasibility of expanded insurance coverage in Michigan. Phase 2, which is the next 6 months up to a year, we can propose pilot programs and collaborate with policymakers. Phase 3, which is from 12 to 24 months, we can implement and evaluate pilot programs and prepare for broader adoption. To support proposed policy change, the following white papers provide in-depth analysis and evidence. For example, Integrative Health and Medicine, Today's Answer to Affordable Health Care is a policy brief. This white paper explores cost effectiveness of integrative health practices, including chiropractic care, acupuncture, naturopathy, and massage therapy, particularly in managing lower back pain. It presents data demonstrating significant healthcare cost reductions and improved patient outcomes associated with these modalities. For a research summary, there is an article called Payer Coverage of Integrative Medicine Interventions for Symptom Management in Oncology. This study examines the extent of insurance coverage for integrative therapies in oncology care. It identifies barriers to coverage and suggests strategies to enhance reimbursement for evidence-based integrative interventions, aiming to improve patient quality of life and reduce overall treatment costs. And then there are case studies such as credentialing, licensing, and reimbursement of the substance use disorder workforce, a review of policies and practices across the nation. Um, let's go back to here. So, did not mean to do that. So anyway, there's going to be some white papers, review studies in the companion documents that we have provided. So take a look, see what resonates with you. And if you have any questions, comments, or concerns, you could definitely reach out. I want to thank you so much for listening to this presentation, and I hope you have a good evening.